Good evening in Kazakhstan and good morning in United States and Latin America, Canada, Mexico, and good night Japan and South Korea and Australia. This is a patient, 73 years old. He's a man and vertebral system is okay. Разрыв помогла, да? Patient had coronary problems, and usually in our country nowadays in nearly all cardiovascular departments they have a protocol for such kind of patients. They are doing CT angiography, and usually we are receiving more and more patients from those departments. And this is 3D rotational, and on A1 segment there is something. There is something on A1 segment, and now we'll see. Yes, there is a small ACOM. It's look like aneurysm, yes. But for the last 3 months we diagnosed several patients with the infundibulum in different locations. Теперь надо будет 3D поставить, Жень. And now we're looking more carefully. It might be also diverticulum. No, it's aneurysm. It's look like aneurysm. It might be infundibulum, but more and more we see infundibulums, but it's look like infundibulum. Let's see. No, the vessel is coming from the ACOM segment and then lying on the sac. It's look like this. It's more look like it's coming from here and lying on the top of the artery. Okay, now we need to find the better position to control during the catheterization. Yes, it's a small aneurysm. It's better to go with the stenting in A1 segment without placing any coils, but this is 2 mm aneurysm and we have one echelon, and let's see. Yes, and at this location these aneurysms are usually most probably will bleed, and it's 3 by 268 millimeter. Okay. I think if we will go with the coiling, then we need the general anesthesia. Yes, it's better to give general anesthesia. Abzal, general anesthesia. Okay. Now we will take some break for the general anesthesia. 2 mm, and the vessel diameter is 167. As we will take septal balloon and then place echelon inside the aneurysm. We'll do coiling with the balloon assistance, and then at the end, maybe at the end we will place stent. Maybe we will finish with the simple coiling. Yes, if it would be 2 mm level baby, then it's possible to do stent mono, but now on the shelf we have only 3 mm stents. The another option is LV Seva. I think LV Seva is possible. Абзал Кайратович. Или спираль салсамыз.
Спираль, конечно, напрашивается. Екі спираль кетеді, болды максимум.
Вот стол жетіп жүрсіз.
Эва тығыз жүрсе присылады. Oldu bu.
You can place LV Seva also. 3 mm through the septal balloon. Okay, let's do general anesthesia. It's yes. Narkozga келеді ғой, да? Okay, let's wait for the general anesthesia. Now camera is off and it will take 10 to 15 minutes and then we'll come and continue. Так, ана инструменттарды алып бер. The colleagues, now patient under general anesthesia. It took 10 minutes. I think it's very quick. And I went to the monoplane Siemens Angio suite and we placed one Silk Vista 4.5 by 20 for patient with IC paraclinoid aneurysm. Just placed and came back. Okay. Эшелон басын 90 градусқа бұрасың, примерно 3 миллиметр просто. Аша бер. Yes, the setting for this aneurysm is scepter 415. Scepter will go with the Traxes and echelon 10 we will take with the Chikai Black. Chikai Black is more stable and it's better. It has better support for the microcatheter during the navigation. Yes, Gamma is not so soft for this location. That's why we will took echelon. Echelon is the last echelon on the shelf, and for this week, maybe next week it will be better. Экранды жарты метр тарта сал. It's all the time same notices. It's all about Kaizen. Yes. Uh, 60% contrast for the scepter. Now I took a 3-way stopcock and I'm connecting 3cc syringe, and then I will take a scepter. We'll connect with this 3-way stopcock and та бровой коннектор без хвостика бери, Саш, пожалуйста. Так, мына жерге бағана айтып едім, екеу жалғандар деп. Бағана өткен жылы. Okay, now I'm taking the scepter like this and we'll push the contrast into the balloon. First, from the dead space, the contrast will go out. There are two purposes. To check the balloon if there is a hole or not. Екі без хвостика бері сал. And it's also the part of preparation process. And to prepare the balloon, to push the air from the system, and also to check the hermetic of the balloon. Yeah? If it's damaged or not. Now this balloon is okay, but couple of times we have seen the hole inside the balloon, on the balloon, and it was leaking of the contrast from the balloon. Yes, all this might happen. Yeah, normal. Okay, for this I will take Traxes, and for the second, yes, I need one more system. Мынаны бересің. Так, қазір қайда тұрсың? Так, бүйтесің. Anlarsın. Abzalını anlarsın. Açıyorsun. Yes, it's all about Kaizen. When we are dealing with aneurysm, usually I prefer to place 2 eye connectors to prevent the thromboembolism, and it's better. It's better to have 2 eye connectors on the guiding. It's more comfortable to work in this fashion. Екі ой коннектор аштың ба, біреу аштың ба? Екіншісі қайда? Екіншісін ана неге эшелонға жылға? Yes, Abzal is assisting me, and Ayolum is our operating nurse. Анестезиолог атын? Asılcan. Asıljan is anesthesiologist. He's a young anesthesiologist in the team. Yes. They're quite experienced. Yes, and the patient is male. He's a man, and he's 73 years old. No problems. Yes, it's a little bit hot because I'm wearing apron, and the cover, sterile cover for zero gravity, is finished on the stock. That's why I need to work in the regular way. And my legs now feeling the pain during the day. I was a little bit lucky when I had for one case cover for the zero gravity. It was only the cover, and now I should work in regular manner. Okay, this is look like cavernous. Yes, and when you're managing the hospital and you are not treating the patients, and then it's very complex to understand the pain of the doctors and physicians. Okay. It's very complex to do 19 cases in 2 days with regular apron. Yes, and then you are swearing, you need to drink more water. When you drink more water, you need to go to the toilet. Yes, a lot of things. Okay. Yes. Mr. Tispitrators. To give second curve. Okay. Yes, I forgot my protecting glasses in Astana. They are with dioptrium, and today I need to work with regular glasses. Okay. Hyperexon қайда қойдың?
Мынаны
72.
қойсам, өткен басы қозғалып кетті ғой.
Oh, yep. Yes. As usual, all navigation system, including the angiographic navigation, when you when you are doing 3D angio and then asking for general anesthesia, after that your 3D angio is useless. Let's see what we have now. Okay. Okay, we have AP and we have lateral. Stop. Yes, let's look like this. Okay. Smart mask.
This one.
Yes, I'm inside the aneurysm. No, I'm inside the aneurysm. Okay. It's touching all the time the aneurysm, huh?
Yes.
Okay. 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 Maybe it's possible to push. Okay, now it's okay. Yes, it's a Traxxas. I like this wire. Yes, but it's quite soft, huh? That's why the receptor is touching the... Okay. I need to go quite distal. Okay, now the balloon is inside. Okay, let's place it in. Place it like this. Now we need new angiography because like head movement, we changed all anatomy with our micro devices. Okay, stop. Okay. Let's check it. Okay, it's better to go. It's a shipping technique. It's more safe. Then we can place it like this. And after that I will pull it a little bit and then our microcatheter should fall inside the aneurysm. Okay. Now I'm inside the aneurysm. I need a coil to weigh something. Okay. Шкаф ташиш? Так, 2 мм ғой да, Мақсатгович, 2 ғой. Так, оно 2 дело-то софт. Екіде тұр Hypersoft 3-ді бересіш, и бір жарымда 4 дайнап қоясың. 2 төрт и 1,5 төрт. 2 төрт. Ашер. Okay, we'll take 2 coils. One is 1 point. 2 төрт. 1,5 төрт ашер. Cheater. Yes, it's a microplex. 1.5 by 4 it will be second, and 2 by 4 will be the first coil. Yes, and this case is number 9 for today. And coil is under a little bit pressure. Now it's okay. Еш нәрсе керек жоқ. Пока еш нәрсе істемей тұра тұрыңыздаршы. Бізге керек жоқ мезотон. Давление керек жоқ. Нормально, еш нәрсе болмайды. Ол өте жақсы давление. Yes, the blood pressure is 58 by 35. Yes, it's around the balloon, that's why I'm not scary. Yes, I think it's okay. And the next coil, I think 1.5 by 4 will be big, and that's why we have a seizure technique. Seizures. I will take my seizures. Так, конец сделай. Все, стоп, назад. Еще. Stop. Yes, this is the length of the coil. На спираль ұзындығы қанша? 1,5 төрт қой, да? Вперед. Екіншісі? 1,5 төрт қой, да, екіншісі? Окей. Етер. Okay. There is a half of this coil. Maybe it's time to place the stent. Maybe. Let's see. Usually coil is enough. And I a little bit pushed my echelon. I will a little bit release it. Знаю. Yes, it looks like it's outside. Okay, it looks like it's outside. Okay. Okay, let's leave it like this. Now, I hope the coil is inside the aneurysm. It's not moving. It's okay. It's not bad. Okay. And when you're doing the angiography, it's very important to give less force for the contrast. Sometimes the coil might move. Yes, this coil will be stable and aneurysm should be occluded. Yes. I think it's the brain. Everything is okay. Now, yes. Just a second. Sometimes we have a problem with the guiding. I think it's outside. Yes, it's outside. That's why it was problem to push the balloon forward. Yes, everything was moved. Now I will place the balloon distally. Okay, take this. We have two options. We have a Pegasus stent, which is also could be okay. It's option number 1. And option number 2. Stop. Вперед. There is a little baby stent here. 3000 istəyirсiniz? 3.18 персер. We have 3x18 little baby. Okay, 318 will be okay. Yes, and all the time I'm saying the very intelligent and smart French friends just put a sign in which direction we need to push the stent. If you're pushing in opposite direction, usually you stand outside of the delivery system. Okay. Okay, this is a scepter, this is a little baby. No, okay, uh-huh. Okay. Scepter is good for Elvis Evo also, but it's something. There is a bradycardia. There is no problem. Okay. I think like this. You can place the stent in here, and then it will end up just at the level of location. I'm not sure. Should we go inside the little baby or yes, because delivery wire is more softer than Traxxas and others. Okay, let's see. Take it out. Okay. Let's zoom. Таймер қоя салшы, Мақсат Гриш. Таймер. Минус қоясың, үлкейтесің. Все хорошо. Ладно. Yes, stent is just ended at the beginning of A1 segment, little bit half millimeter inside the ICA terminus. It's okay. Now the first control angio, and after this control angio, Abzal will do expert CT, and after expert CT we'll wait another 9 minutes and we'll place we'll do last control at the minute number 10. I will take back my guiding to the common carotid. Yes, it's very important to prevent any spasm or emboli. Yes, and now I will ask Abzal to do control expert CT. Мақсат Гриш, 5 секунд қала жасаш КТ-ні. And next couple of patients with the MC aneurysm. The next patient with thrombocytopenia 53 to 65. It's a chronic thrombocytopenia, and we will do under local anesthesia because anesthesiology team exposure. Каз, тратор. 1 секунд. Все, жалғастырайық. Звук можно продолжать. And the second patient will be also the two MC aneurysms. The first under local anesthesia, and the second will be under general. In second angio suite, monoplane Siemens, we did a ICA supraclinoid aneurysm oriented on the top of the artery, on the upper face of the ICA. We placed LVCVO, and now, the second case was paraclinoid aneurysm, 5 millimeter. We placed Silk Vista. Yes, the both operation done under local anesthesia, and now КТ можно будет по центру поставить. Yes, I'm asking Evgeny to put CT in the middle. Yes, this is a ACA territory. The brain is normal. There is no possible complications. The stent is in place. Let's see on coronal view. Everything is okay. Macaroni of the baby is in place. This is a macaroni. Little baby macaroni. Pasta. Okay. Now we'll wait another 6 minutes, and then Abzal will do control angio if everything is okay. Abzal, Abzal in 6 minutes will do angio. If everything will be clear, he will show like this. In Kazakhstan, it means everything is okay. Okay? On minute number 10, control angio. Thank you. See you in 25 minutes.
Болды бітті.